Hello, I'm Cindy Perlin from the Alternative Pain Treatment Directory, and I'm here with Dr. David Clark. He is the president of the Association for the Treatment of Neuroplastic Symptoms, and he's an MD. He's board certified in internal medicine and gastroenterology. Welcome, Dr. Clark.
Thank
Um,
you, Cindy. Great to be with you.
so, um, So can you just give like a very brief description of what neuroplastic symptoms is just to get started and then tell us how you got into this work?
Yeah, it's very simple. Most people assume that if you've got pain or illness, it must be from an organ disease or structural damage. But there's actually a whole other category of absolutely real symptoms that are generated by changes in nerve pathways in the brain. So it can be anywhere from head to toe, migraines, visual disturbances, dizziness, ringing in the ears, pain in the spine, chest, back, pelvis, abdomen, genitals, joints, and also non-pain conditions, irritable bowel syndrome, lump in the throat, many cases of long COVID or chronic fatigue syndrome, certain kinds of rashes, functional neurologic disorders, pseudo seizures. The list just is virtually endless. The only common denominator is that people tend to have more than one symptom at the same time. Sometimes there are also symptoms that move from place to place or are not triggered consistently by the same thing. But the good news is that if you can identify the underlying causes, which have to do with stress, trauma, emotions that have been repressed, other challenges in life, all of which can be not fully recognized, to be honest. People may have these, but not really understand the impact that they're having. But if we can identify them, bring them into conscious awareness, we can treat them successfully and people can get better even after they've been severely ill for years or decades. And you asked how I got into this. I was very traditionally Western trained. I mean, I had no idea about any of this. I had to be dragged into it through, direct experience. I got through 7 years of very advanced training. I got an award for diagnostic excellence. I got high scores on my exams. I got into a great residency program. And so the last thing I expected was to run into a patient I didn't know the first thing about diagnosing or treating. And this was a 37-year-old woman who was sent to us by another university because they couldn't figure out why for 2 years she had been averaging one bowel movement per month.
Wow.
She
Oh,
was
that's got to
taking
be painful.
4 different laxatives at double the recommended doses every day. Wasn't working. We did some specialized testing that we thought for sure was going to be abnormal. That was normal too. So I was doing her exit interview, essentially telling her she was going to have to live with this because there was nothing else we could do. But I stumbled on the fact that she had been abused as a girl. And this had stopped happening 25 years in the past. So I didn't think it could be connected. But there was a psychiatrist at UCLA where I was in training that I knew had an interest in these brain to body conditions. And so I said, okay, great. I've got something I can do to help this patient live with her condition. Well, 3 months later, I forgot all about the patient. I went on with learning how to put endoscopes in people. But I ran into Harriet in what turned out to be the elevator ride that changed my career because between the ground floor and the fifth floor, she told me she had cured this patient with less than 3 months of weekly counseling sessions. And that just
Wow.
shocked me that you could alleviate a serious, very real physical condition just by talking to somebody. So I thought, if I'm going to be a complete doctor, I should know how to do this. I don't feel comfortable being completely ignorant about a cause of serious illness in my patients. So I had Harriet teach me her framework. And I started using it when I got into private practice in Portland, Oregon. And it just grew from there. And that was 40 years ago. As of today, I've treated well over 7,000 people with this.
Wow. So you were really a voice in the wilderness way back then, because, I think the idea of neuroplastic pain and neuroplastic symptoms is just getting some recognition now, just getting some attention now.
Yeah, there has, in the last 5 years, there has been some gold standard science that has put this concept to the test, and it's been dramatically successful. The first of the modern studies was done in Boulder, Colorado. It's called the Boulder Back Pain Study. They took a group of people who had had back pain for 10 years, chronic pain, significant pain, and they put them through the new neuroplastic recovery psychotherapy,
Mhm.
just 2 sessions a week for just a month, and their pain scores plummeted. It went from an average of 4 out of 10 down to 1 out of 10, and they stayed down. Even though there was no further treatment, pain scores stayed down for 11 months of follow-up in the study. Nothing like that had ever been published before, and it's now been confirmed and replicated at studies across North America.
It's amazing it took that long for things to get studied, but I think one of the problems is that a lot of studies are funded by the pharmaceutical companies, who of course don't have an interest in any of this. And there's not that much funding for non-pharmaceutical studies.
Yeah, and nobody, even the researchers themselves were highly skeptical about this. Just the same way I was. We were going to them and telling them that we could alleviate people with serious back pain just by talking to them, and they said, "I don't think so. We'll do the study. We'll see what the data shows, but this just doesn't sound right." And I was just as skeptical, so I could sympathize with their point of view. They were shocked when they saw the results. And on top of that, they did scans of their subjects' brains before and after the psychotherapy. And the talk therapy not only alleviated the pain, it physically changed the neuroanatomy in the brain. It was just remarkable.
So I want to get to what the actual treatment you're using is, but before we do that, how can someone tell the difference, or how can a healthcare provider tell the difference between pain or medical condition caused by a physical cause and pain caused by an emotional or psychological cause?
Yeah, it can be a challenge sometimes, but first you obviously want to do the diagnostic tests that are appropriate for the patient's symptoms and see if you can find an organ disease or structural damage. Where it can get tricky sometimes is in, for example, the spine, where most people over the age of 40 will have some abnormalities in their spine just from the normal aging process. They've done studies where they've done X-rays and magnetic resonance images of the spine in people who feel fine, people who don't have one bit of spine pain or disability, and they still find these abnormalities in most people over age 40. So you don't want to jump to the conclusion that if somebody's got pain and they've got a little abnormality in their spine without evidence of an actual damaged or pinched nerve, you don't want to jump to the conclusion that this age-related abnormality in the spine is responsible. So it can be a challenge in those circumstances. But the other thing that we do is assess people for their stresses in life, either past or present. Very large number of these patients were under stress that we call adverse childhood experiences. Anything that you experienced as a kid you would never want for a child of your own, for example. And those can play out in all kinds of ways that are highly stressful for adults. But if we identify them, we can address them, alleviate them, and then that leads to improvement in the symptoms. On our website, symptomatic.me, we've got a 12-item quiz that's set up in a way that the more of those questions to which you answer yes, the more likely it is that your pain or illness have a neuroplastic component to them.
There was a study that was done quite a few years ago about the success of back surgery. And they found that the more adverse childhood experiences someone had, the less likely back surgery was to be successful. And, with one adverse childhood experience in one category, it was, 80%. When you got to 5, it was 0%.
Yeah, I remember that study very well. It's in the bibliography that we have on our website where we've got over 200 references. This was back in 1993. when they were not dividing the ACEs into 10 categories, but instead into 5. And if you had no ACEs, the success of the spine surgery was, I think, 95%. But if you had 3, 4, or 5 out of the 5 categories, success rate was only 15%. And I like to point out that if that was a blood test and you could predict the outcome of your spine surgery using that as a blood test, everybody would get that blood test. The spine surgeons themselves, if they were having spine surgery, would want that blood test to see if it would predict their outcome. But, are we asking our prospective spine surgery patients about their ACEs? Are we investigating them for brain-generated as opposed to spine-generated pain? For the most part, sadly, we are not.
Yeah, and I think that's so unfortunate. And you're saying that was 93. So we're talking that's been out there for 30 years. And, I find that that's true of a lot of things, when you're talking about chronic pain or anything else, that doctors are so busy, they get a limited education in medical school, less than 2 hours on average having anything to do with pain, according to one study. And then they get out and they're so busy that they don't see these studies, and they don't become more familiar with it. So we really need to change medical education.
It's starting, and I agree with you 100%. And I've been teaching in the medical school here in Portland, Oregon for several years now. And so their graduates are now coming out of the education and knowing about this and being able to look for it.
And you said something earlier when we were talking about you have a course on your website for physicians.
Yeah, on symptomatic.me, we've got several courses. We have an introductory one, and they all are jargon free so that not only can physicians take them, but so can mental health professionals, because it's a collaboration between the medical and the mental health communities that provide the best outcomes for people. But another fringe benefit is that the public, people who don't have any formal medical training at all, can take these courses. And we've got the intro one. I've got one on challenging cases. People who support the nonprofit by becoming members will have access to a new course that is a deep dive into the kinds of interviews that I do with patients in my office. And I've got a new podcast myself called The Story Behind the Symptoms, where I'm interviewing a patient, much as I did in my office, and you can see the kinds of issues that I look for.
So, I think one thing that's very tricky is to have a patient come to you and, they've had pain for a really long time. They're really in terrible pain. And, it's very delicate to say to them, this could be in your head. It may not be physical. So how do you handle that difficult conversation?
Well, yeah, it's a good question, but none of this is in your head. It is all in your brain. It's changes in the neuroanatomy, changes in the nerve circuits that do this. So there is a real physical cause for this. It just happens not to be in the location where you're feeling it.
Hmm.
But the good news is that if we can identify the sources of stress that are responsible for the changes in the nerve pathways, we can turn this around. It's astounding just how ill you can get from this process. One of my patients had symptoms for 79 years.
Oh,
Uh,
wow.
and
And
she
how
was
old was she?
she was 87. She was a nurse, so she had, long time contact with the healthcare system, got, all kinds of diagnostic evaluations over the years. Um, but she went through a trauma when she was 8 years old that was still affecting her all those years later. Once we brought that out into the open and helped her to address it, she got much better. Another
Yeah,
patient,
well, that's pretty amazing. I mean, that's the longest history I've heard
my
in my
personal
career.
record, yes.
It's
Yeah.
got to be most people's personal record. I mean, you can't get much worse than that. Maybe, something that happens to you when you're 2 and you're in your 90s, maybe.
But
But
it can
no,
also be in the severity. I mean, another patient, 17-year-old, in the hospital for 70 days when they called,
wow,
getting morphine around the clock in massive doses for
wow.
unexplained abdominal pain. I was gastroenterologist number 7 who have been consulted on this patient over the previous 18 months. But
Wow.
we identified the stress. This case is also in the challenging cases course on our website. And we have monthly, I should mention, monthly Zoom meetings where you can ask questions of our experts. That's another resource we provide. But that patient who was on the morphine identified the stress, helped her start to cope with it. She was out of the hospital in a week, and she was off of all pain medications in 30 days.
Wow. You're like a miracle worker.
Well, I love those cases where things turn around quickly.
Yeah.
There
Yeah.
are
They
people
don't
who
always
need,
happen that fast. So I
some
want to
people
go
need
back
years
to
of psychotherapy. Yes.
I want to go back to something you said earlier about trauma or adverse childhood experiences. You said that they were anything that happened to you as a child that you wouldn't want to happen to someone you care about. And that reminds me of, a concept I ran into recently that I'd never heard of before, which was small T trauma. So it's not always like the big stuff that causes traumatic responses. Sometimes it's the constant criticism, it's the, not feeling loved or being invalidated. So can you talk a little bit more about that?
Yeah, you're absolutely right. And that's a big factor in a lot of my patients. They look back and they'll say, oh, things weren't that bad. Other people have been through worse and they don't seem to be affected by it. I think I've moved on from that. And yet they have evidence of a long-term impact from this. They may have stressful personality traits like perfectionism or being extremely self-critical, or not taking enough time every week for their own joy because they are so focused on taking care of everybody else in their world. They don't put themselves on the list of people they take care of. They may have emotions that they've repressed that they're not aware of, and they may have triggers in their life, people, situations, or events that are highly stressful because they are linked to or reminiscent of issues that they went through in the past. And it can be very subtle issues. A patient I interviewed from my podcast recently, she just wasn't ever allowed to feel her negative emotions. If her parents saw that she was angry or upset or afraid or felt ashamed, they would just say, "Oh, honey, don't feel like that." They wouldn't acknowledge it. They wouldn't grant her the value that those emotions had a reason for being there and needed to be expressed. So she grew up feeling devalued because of that. Another patient of mine, it took him a while to figure this out, but he suddenly realized that when he was growing up, he only got praise from his parents when he did something better than his brothers and sisters could do it. And his brothers and sisters, he had 3 of them, they were very accomplished people. It wasn't easy to do better than they did. So he ended up feeling like a failure when he grew up. And uh,
Mhm.
now he was 37. He was a successful attorney, but the rest of his life had some serious problems.
Mhm, mhm. And those kinds of things cause daily stress that can lead to physical symptoms, changes in the brain, or changes in the developing brain, not developing a very healthy brain, I would think, from those experiences. So it's not just the physical assault, the sexual assault, the living through a natural disaster. It can be these, daily emotional or soul injuries that people grow up with. And sometimes they don't even understand that they experienced that because it was all that they knew.
Yeah, and it's when you look back at your own life, none of us has a parallel life to compare ourselves with. So it just feels normal to a lot of my patients what they went through. That's why I asked them the question, how would you feel if your own child or a child you care about was growing up exactly the same way and you were forced to watch it happen? How would you feel about that? Would you be sad or angry watching this happen to a kid you cared about? And a lot of people, that changes their perspective completely.
I think that's a good question. I'll have to use it in my own practice.
Please do.
So, there's also the issue of, I've met a lot of people in my work, and I should mention I'm a licensed clinical social worker, and I work a lot with people with chronic pain. It's one of my specialties. And I get a lot of people who come to me and they've been in psychotherapy for years and years, and they're still not better. So what's the difference in terms of what you train people to do and what you do that's effective for this type of condition?
Yeah, there are some big differences. As you know, what dominates psychotherapy in the US is cognitive behavioral therapy. There are, scores of others, but that's the big elephant in the room. But most people who receive that, it's more about helping them live with their pain than alleviating it. So that's the biggest single difference, is that with the new neuroplastic recovery therapies, we call them, and there are several subtypes. We are trying to alleviate physical symptoms, whether it's pain or some form of illness. The second thing is we are beginning our treatment by shifting the person's attention from wherever in their body the symptoms are being felt, up to the brain where the symptoms are being generated. And from there, figure out, okay, what are the stresses, past or present, or traumas or emotions or other life challenges, any of which can happen to anybody, no matter how mentally strong they are. What are those things that are going on in the person's life? And when we uncover those, they can usually be addressed successfully.
And
And
how do you address them? So they're
oh,
out in the open. People have acknowledged, yeah, my mother was, overly critical and that had a negative impact. And I've internalized that. I do that to myself. So how do you address that?
well, usually we'll start with looking at the personality traits that a person has that are stressful. So if you're a perfectionist, if you're highly critical of yourself, if you are somebody who is taking care of everybody else in your world, we want you to put yourself on the list of people that you take care of. We want you to carve out a block of time on a regular basis where you start doing some trial and error and find out what it is that you need for your own joy. Because if you are not doing that, it's an essential human skill. And without that, you're on a treadmill that you never step off. And sooner or later, your body is going to protest one way or another, either with pain or fatigue or something else. So we work on that. Then we're going to look at any triggers you might have. And the most common of those is a parent who mistreated you as a kid who is still in your life. Um, the first story in my first book, which is titled They Can't Find Anything Wrong, was about a patient who was hospitalized at a prestigious university 60 times in 15 years for
Mhm.
attacks of severe dizziness and vomiting. And they had no diagnosis for her. And she happened to have one of her attacks when she was here in Portland. She ended up in my hospital. And I found out that all the attacks were connected to direct or indirect interactions with her abusive mother. And as soon as she saw that connection, I can still remember, she looked up at the ceiling and said, "Oh my God, I can't believe it."
She
And
really never made that
she
connection
never
until
made the
now.
connection. I mean,
Wow,
you
there's a
would
lot of
think if something
denial
like
there.
that was making you physically ill, you would see it, but yeah, she didn't. And by helping her to see that, in her case, she was cured on the spot.
Did
So
she
that
stop seeing her mother? Did she stop having contact?
she absolutely put some boundaries. Yeah, and that's part of the work too. If you've got a trigger, we're going to help you put some boundaries around that trigger so that it doesn't make you physically ill. And then the third major area of long-term impact of ACEs are the emotions. A lot of my patients are like dormant volcanoes on the outside with boiling magma on the inside. And the emotions often are anger, but sometimes fear, shame, grief, guilt. I've seen all of those. And we want to identify those. We want to bring those into conscious awareness, and we want to help people put them into words. Very common example is just to write a letter to the parent who mistreated you. Not to mail it, just to write it. Put all those emotions, good and bad. Many people still have positive feelings, even toward parents who've not been so good. But put all those emotions into words. And the more they go into words, the less they need to go into your body in the form of symptoms.
Mm-hmm. Mm-hmm. Yeah, there was a study done. There was a guy, Pennebaker, I think was his name. And
James Pennebaker.
yeah, he did a study where he had college students write about a trauma they'd never talked about and wrote about for 7 days in a row, and then looked at their health utilization, health services utilization before and after they did that process. And there was a real dramatic difference in terms of a reduction in medical utilization. And then he went on to do other studies. One book of his I read, whenever there was a natural disaster, he would run right over and, do these studies with people who were experiencing trauma, and get them to write or otherwise express them. And I think his work was very important. And it's such a simple thing to do. You don't need a therapist to do it. You can do it on your own. And it can be very helpful.
Yeah, his research is excellent and supports the value of this approach.
Well, that sounds great. How long has your organization been in existence?
14 years now. I've been the president the whole time, but we have a wonderful board of directors, lots of different professions represented there, doctors, psychologists, journalists, patient advocates, business people. And we've been growing steadily ever since we started. We had a international conference last October in Boulder, Colorado, 270 people from 8 countries. So it was so
Wow,
successful. We're doing it again in 2025, September 28th to the 30th, again in Boulder, Colorado,
nice place to visit too, Boulder.
especially that time of year.
Yeah, yeah, I may join you there.
Great. Love to see you.
Yeah, so you have a lot of resources on your website for people. I know you said you had that questionnaire. I took it myself and ended up 50-50, in terms of I had half of them as a yes. And I have had my share, I think, of neuroplastic pain over the years. So that was kind of interesting. So anyone can do that. And I know you have a very extensive bibliography. You have the courses that people could take. So that's great. So your website is symptomatic.me.
Yeah, it's a lot easier to remember than the name of the nonprofit.
Yeah. Well, that's a good idea to have an easy to remember URL for people to find. So is there anything else you'd like people watching this to know?
Well, I want everybody who's suffering physical symptoms from this cause to recognize that there's tremendous hope. Even people who have been severely afflicted for years can recover using this approach. And it's not as widely known amongst the medical community as we would like, but because the research is confirming the value, we think it's only a matter of time before the healthcare community incorporates this into their practice routinely. And that's yet another reason for hope.
Yeah, well, that's good. So, I like to say when everything hurts and you're falling apart, look at these emotional causes, these stress-related causes. So thank you so much for spending time with me today and educating people on the valuable work that you do. And again, people can go to your website and symptomatic.me. And I assume there's contact information for you if they want to get directly in touch with you.
Yeah, info@symptomatic.me is the best because it gets to my operations manager and she's more reliable. I'm always bouncing around giving speeches and responding to requests for written information. So she's the great contact for me.
Oh, okay. And if it's something where people urgently need to talk to you or want to book you, they can get to you through her.
Yes, absolutely. Info@symptomatic.me.
Okay, well, thank you so much.
Thank you, Cindy. I really appreciate it.
You have a great rest of your day.